Hello and welcome to this lesson, fibroadenoma. So fibroadenoma is a benign tumor of the breast and it is usually affecting young women, and it is more common in black races, and it's a mobile mass which is well defined, rubbery in nature, and it's encapsulated. And it is usually referred as a breast mouse because it is highly mobile and it can move within the tissue of the breast. The tumor has a stromal and epithelial component, and it is usually a very small tumor, and it is usually less than 5 centimeter in size, which has no potential for malignant conversion. So what are the types of fibroadenoma? There are three main types that you have to know for your board examination. There is a simple fibroadenoma, which is the most common type, and it has a uniform structure with minimal risk of malignant transformation. We have another type which is called juvenile fibroadenoma, which is happening more in adolescents and young women, and it is usually larger than the simple fibroadenoma, 5 centimeter or even more, which can cause breast symmetry due to its size. And note that this type actually has a rapid growth rate and has epithelial and stromal component, and in this type you are going to see epithelial and stromal hyperplasia, but there are no atypical cells in the tumor, and as the result this tumor also has low potential for malignant conversion. Another type, which is probably the most dangerous type of fibroadenoma, is a complex fibroadenoma, which has typical fibroadenoma, stromal and epithelial hyperplasia with fibrocystic changes. And when we have a fibrocystic changes, the changes are going to involve with cyst, calcification, sclerosing adenosis, and this type of the tumor has a higher risk for malignant transformation, and it is usually happening in the women who are older in age. So what are the presentations? What are the clinical findings in patients who are suffering from fibroadenoma? This is a painless tumor with a firm and well-defined borders, and it is usually highly mobile. This is why we call it breast mouse, and it is usually found incidentally by routine examination of the breast, mammography, or even ultrasound. And note that most of the fibroadenomas are stable in size or grow slowly, but the growth rate can be affected by the pregnancy and hormonal therapy. Both pregnancy and hormonal therapy can slow down the growth of the growing fibroadenoma. And note that during postmenopausal period, due to the fact that the patient is having low amount of estrogen, we are going to experience reduction in size of the tumor. Now, what are the diagnostic tools that we can use for diagnosis of fibroadenoma? First of all, physical examination is very important. Again, you are going to see a painless, mobile, and a well-defined tumor. And the ultrasound, which is the first line imaging, usually done for the younger woman, you are going to find an hypoechoic solid mass which is darker than the surrounding tissue. So here this is an ultrasound of fibroadenoma, and you can see you are seeing a well-defined tumor and a darker area relative to its surrounding structures. So another test that we can use for the fibroadenoma is mammography, and it is usually done for the women who are older than 30 years of age. And in the mammography you are going to see a round oval mass which is a well-defined in nature. And here you are seeing a mammography of a patient who is suffering from fibroadenoma. You see several fibroadenomas, one here, one here, one here, and one here. Another test that we can do is fine needle aspiration, which confirms the diagnosis of benign lesion. But note that the fine needle aspiration has limited ability for differentiating tumor from other tumors because it's not gaining enough tissue of the breast and enough tissue of the tumor, so the structural features of the tumor cannot be fully understood by the fine needle aspiration. If you need a definitive diagnosis, you need to do core biopsy, core needle biopsy, which gives you definitive diagnosis of fibroadenoma. So what are the differential diagnoses for fibroadenoma? So in the differential diagnosis, you have to consider phyloid tumor. This is another benign tumor of the breast with the same structure. It has stromal and epithelial components. But note that in case of phyloid tumor, we have higher risk of malignant transformation, and also phyloid tumor is going to grow more rapidly and on the histological panel you are going to see a leaf-like structure like one you are seeing here. These are the leaf-like structures of Philode's tumor. Another differential for fibroadenoma is a breast cyst, which can also appear as a mobile mass and can be differentiated from fibroadenoma by the ultrasound. In the ultrasound, you are going to see a cyst that is filled with the fluid. So breast cancer is another differential for fibroadenoma, but note that these cancers are actually happening in older patients, and note that breast cancers and the lumps that are created by breast cancer, first of all, are solid, they are a little bit larger, and they are mobile, and they can be malignant. So if the patient is older and you are suspecting that this is not a fibroadenoma and it is a cancer, you have to do workup with the core biopsy and fine needle aspiration in order to rule out the breast cancer. Now, what are the treatment options in case of fibroadenoma? First of all, this tumor is usually benign and stable in size, so observation will suffice for management of these patients, especially the fact that these tumors have either no or low malignant potential, so they can be observed via ultrasound or physical examination. And another option that we have here is surgical excision, and surgical excision is recommended to few groups of patients. First of all, the patients who are symptomatic or there is an uncertainty about the diagnosis of fibroadenoma. In case of juvenile adenoma, surgical excision is recommended in order to avoid deformity. Note that this form, juvenile fibroadenoma, is bigger in size and can cause breast deformity and breast asymmetry. In case of fibroadenoma, because we have potential for malignant conversion, the surgical excision is recommended to the patients. And in case of recurrent fibroadenoma, in order to save the structure of the breast, we are recommending the patients to have surgical excision of fibroadenoma. Cryoablation is another minimally invasive procedure, and we are using extreme cold in order to destroy the fibroadenoma, and it can be offered to the patients for cosmetic reasons or for removing the tumor from the breast tissue. So the summary: the fibroadenoma is a benign tumor. It has a low malignant potential. It is happening in younger women, and this tumor is mobile, palpable, and rubber-like. And this tumor is actually responding to hormonal status change. For example, pregnancy can reduce the size of tumor, and management is usually conservative, except when we have complex form or juvenile form, or we have asymmetry in the breast tissue. Thank you for watching.